Taking it can translate posteriorly, but highly likely that's going anterior. So the only biomechanical correction that we're going to do is we're going to bring the femoral head back into the socket.
What about superior?
Uh,
Because the Sarman slide there could be a superior translation.
Yeah, that's super theoretical.
Oh, okay.
So the thing is,
That was a good
you're not, no, because she has these outlined. Now, one of the reasons why her movement patterns are the way that they are is because they're muscularly driven. All right, so she's really looking at the overfiring of the psoas that pulls that femoral head anterior and superior. So it's this like muscular compensation that's driving it superiorly. When you do your mobilizations on the mat, there are ways to do an inferior glide, so that kind of fits that model. But trying to do a biomechanical correction in standing with an inferior glide, that's kind of tough. You have an inferior glide in standing? Yeah, no. Right? There are tricks that you can do to lift the ilium, but it's still all muscular. All right? So it's a little different than in the humeral head, because the humeral head you can do that inferiorly. Okay? So here is the posterior glide for the femoral head. I'm going to place my hands in the front of your hip here to stabilize the front of your hip. Is that okay?
Yep.
Okay. So I come in here, I find the ASIS, I drop in about a third. My finger pads are over the femoral head. That should look really familiar because it's exactly the same as yesterday. Okay? The difference here is the palm of my hand is going to aim towards the acetabulum. Let's walk. Okay? Acetabulum. Yesterday, we did sit bone for low glute. Here we're going acetabulum because we want nice counter pressure at the pelvis. So I'm coming in here. I'm moving around the muscle a bit. I'm going to provide more pressure because I'm trying to physically move that femoral head back in the socket. And now go ahead and squat. I dance with the joint as she moves. And that's it. It's very similar to the external stabilization. The difference with the external stabilization is you're just trying to coax the muscles to kick on. So you're going at the sit bone, you're trying to convince the low glute to come on, you're hugging in front, you're giving a little lift to stimulate the nervous system. Here, we are trying to do the arthrokinematic glide. I am stabilizing at the back of the acetabulum, I'm grabbing the femoral head, I am moving the femoral head posteriorly. Okay? And then as they move, you dance with the joint.
The backhand is just your that's your stabilizer.
It's a stabilizing hand, but it has to dance with the joint as well because the pelvis
But you're
is
not
moving.
adding any, the force is coming from.
The movement, remember, for every manual technique, there's a stabilizing hand and a moving hand. Acetabulum is stabilizing hand, femoral head is the moving hand, or mobilizing hand. Okay? All right, go for it.